Patients who come through the Community Cancer Institute are not only offered state-of-the-art comprehensive cancer care, but may also have the chance to enroll in clinical trials, which can ultimately lead to better, faster care for patients. When Paul Wilson found out he had a form of leukemia that strikes mostly older people, his friend told him to seek treatment outside of the valley. But Paul stuck with his primary care doctor's recommendation to go to Community Cancer Institute, just 20 minutes from his home. That's where he met Dr. Haifa Abdulhaq, Director of Hematology at UCSF Fresno, who explained the type of leukemia Paul battled.
CLL is chronic lymphocytic leukemia, which is a type of blood cancer that happens mostly in older patients, and it is a chronic disease, so people can have it for many years without having symptoms. However, when it progresses, it can lead to severe increase in the white count, anemia, which is low red cell count, as well as low platelet count.
Paul, who is 79 years old, wasn't feeling any symptoms of his CLL. It was caught through routine blood work from his primary care physician. But Dr. Abdulhaq explains Paul's case was unique.
I did some additional workup and I found out that Paul actually has one of the aggressive types of CLL, or what we call high-risk CLL, because he had a gene which is the TP53 deletion or 17p deletion, which means a part of the chromosome 17 is missing.
Symptoms of CLL might develop as the cancer progresses, which can include enlarged lymph nodes, fever, night sweats, and fatigue.
So how is he doing today? He's doing very well.
Paul wasn't showing any symptoms, but Dr. Abdulhaq wanted to monitor his case. That's when she noticed a change in his blood counts.
Gradually, his white count started increasing, and at some point it went up to 160,000, and I noticed also that he was starting to have some anemia. His hemoglobin dropped.
Standard treatment for patients with CLL include targeted therapy, but Dr. Abdulhaq found she could offer Paul more.
We do know that with his specific subtype of leukemia, the prognosis is not that good, and his chance of progression is higher than other patients. And because of that, I discussed with him a clinical trial that we have here.
Paul says he put his trust in Dr. Abdulhaq's advice and expertise.
She was very thorough, very informative.
This trial is a randomized trial where patients are randomized either to receive the standard of care treatment or to receive a triplet. And this triplet means 2 pills, 2 that are targeted therapies, as well as an antibody.
Paul underwent the triplet therapy, and after just 2 treatments, was experiencing phenomenal results, with his white blood cell count dropping back into the normal range of 6,500 from a high of 166,000. Paul is back riding his bike most days. Community Health System's long-standing partnership with UCSF Fresno gives local patients access to high-quality, affordable care and clinical research studies and treatments.
You know what? Where I'm at is where I should be. I really feel that I'm getting very good treatment, and I'm close to home. I don't have to figure out anything.
Dr. Abdulhaq says they will do a full assessment of Paul after 15 months of his triplet therapy.
If he is in complete response or complete remission, and we have no evidence of residual disease, then the plan is to stop treatment at that time and just follow him closely.